Do you really want someone else making life or death decisions on your behalf without you even knowing what you truly want? Let's talk why advanced directives are necessary and why you should make your wishes clearly known. Hello everyone, this is Dr. Kundlas. Welcome. Today we will be discussing why advanced directives are necessary. And by the end of this video, you will be clear how much pain and suffering you will avoid for yourself, how much emotional trauma and guilt you could save to your family members, and how effective you could make your healthcare team. Advanced directives is a tool which you prepare today, which involves two components. One, appointing somebody as your healthcare proxy who makes decisions for you and speaks on your behalf. And living well, which outlines all your wishes. In the absence of your wishes to be known, healthcare systems rely on default systems. If you cannot make decisions for yourself, your spouse will make the decision. Then it's your children, then surviving parents, then family and friends as we go along. There's nothing wrong with any of those people making decisions, but do they know you? Advanced directive involves deep self introspection. We have created another video in detail about living well. I truly believe that's a master class on living well. You should watch it and get yourself educated and familiarize what it involves to be living well. In this video, I want you to understand if you do not express your wishes, then somebody else will make the decision. Personally, if you don't let your family member know what you want, they will make the best decisions for you, which may or may not be in line with what you want. You must let everybody know. Once everybody knows your wishes, when the time comes, they are not emotionally attached. They could make those decisions objectively in line with what exactly you want. That will save them a lot of emotional turmoil, guilt, and pain and suffering. And also, you will prevent family feud. You may have multiple children or multiple family members who could influence that decision. If you do not let them know, they are obligated to talk and come up with a consensus statement. You have no idea how many times in our offices we have almost fist fight between your siblings, your children, and other family members who have a different opinion or different understanding about you. So you could save and spare your family pain and help them they make decisions based on your guidance. As healthcare providers, will do much better job if you guide us properly. We do not have to wait for default consents, who is the one whom we should be listening, and we could make prompt, quick, and effective decisions on your behalf. Your family should be very clear that who's the power of attorney is, what your living will says, and there should be very clear guidelines. You will be in charge controlling your care through this legal processes and through your healthcare proxy. You will get clear, concise care and you will be in charge. Unfortunately, if you do not decide for yourself, you will create a lot of emotional trauma and you may delay your care. And that is not in your best interest. Every doctor's office have forms to create your advanced directives. Ask their help. They will provide you. They will guide you. And be prospective. No matter how young you are, anybody above the age of 80 should consider getting advanced directives. It is a proven fact that in the United States, people living in northeast states like in New York, upstates, they have very high rate of advanced directives. In those states, there is 60% of the population have advanced directives. They are doing something right by educating patients. As we go into southern states, the rate of advanced directive keeps going down. In the United States, only 37% of the population has some form of advanced directives. If you do not guide us, you will get poor quality care. Advanced directives have a lot of ethnic and racial disparities. Black populations, Asians, and Hispanics have relatively very poor rate of advanced directives. Culturally also, there is a major issues which are recognized. Through these videos, my intention is to live life fully, and at the end of life, we must control our care properly. Let's introspect about different aspects of your life and especially end of life. At end of life, you must decide for yourself when you reach there whether you want to be resuscitated, whether you want to be put on a ventilator, whether you want feeding tubes, whether you will accept dialysis, how comfortable you want to be, what kind of treatment, procedures, organ donation, experimental drugs you will accept, whom you want to be notified, how you want to be addressed, and what are your cultural or religious beliefs which you want your healthcare team to obey, and you should get quick, comprehensive care so that you leave this world with self-respect and dignity. I hope I have convinced you that everyone should think about having advanced directives. Ask your physician, they will guide you to navigate this difficult discussion. Thank you very much. I will see you in next video.